So Sam, we're now going to use one of our mannequins to talk through the emergency algorithm. We're going to start with looking at a dislodged tube. So the first part of the algorithm is the safe approach. So we want to check that our area is safe and if necessary, shout for some help. So the next stage on the algorithm is to open the child's airway. But something that I think is particularly important is to check that the tracheostomy is actually in. What can happen is it can flip out, but that is hidden by the dressing. So for example, if we come to Daisy and lift up her dressing now, her tube is actually out, but that wasn't initially visible. The next stage is to ensure that high flow oxygen is applied to the face and tracheostomy. If you have a non-rebreathe mask to hand, use that. If you have a face mask, you can use that until you have something else available. So the next stage of the algorithm is to suction to assess the patency of the tracheostomy. But as we know this tracheostomy is dislodged, we can actually skip that section and move on to the emergency tube change. So in our emergency trachea box, we have some scissors. Sam, please will you cut the tapes and then I can replace the tracheostomy. I'm going to start by trying to reinsert the same size tube. If I cannot get that in and the patient is in a good position, I'm going to move quickly to trying to insert the tube one size down. So once the tracheostomy is inserted, immediately remove the introducer and ask someone to hold the tracheostomy. Sam, if you could hold that for me. Thank you very much. So now we've got a new tube in, we're going to reassess our patient, continue administering some oxygen while we do that and get them nice and stable. Once we're happy with that, then we can secure the tube with some tapes.